I want to take a deeper look, in fact, at the recent coronavirus spike here in North Alabama.
We are joined now by Dr. Hassoun, an infectious disease specialist at Huntsville Hospital. Thank you so much for joining us tonight.
Oh, thank you for having me again.
Dr. Hassoun, we just discussed testing and hospital supplies. Are there enough in North Alabama to keep up with the current and recent spike?
So, at the moment, the hospital supplies, specifically what we call the personal protective equipment, is available. Testing, still there's issues of shortage with it, and we're really not able to test everyone that we are willing or want to test. The shortage of PPE gonna happen if we continue to have these issues of spike with the patient hospitalization, and at the same time, some of these cases are severe where they end up staying in the hospital for a long time. You're gonna need PPEs for a long time to take care of each patient. And that, again, it's going to be concerning. We might end up with having shortage, and what to do about it. We're going to need to see how things go.
Yeah, we reported on people who have been released from the hospital after 3 months in the hospital, and we also have heard stories that one patient with coronavirus, that healthcare provider has to wear about 10 times the amount of PPE that would be for a normal patient.
Oh, absolutely. It's significant use of the PPEs because, there's a high risk. If you don't wear the PPE, you will be at high risk of getting the infection. And unfortunately, that can happen even with exposure of 5 to 10 minutes. Yeah. So you need to have these PPEs every time you get into the room.
Yeah.
There.
Wow. So hypothetically, what would happen if a hospital or a group of hospitals runs out of supplies? How does the system deal with that type of situation?
Yeah, so there's always contingency plans of what to do, and part of it is you start more reusing certain stuff, which is, in general, these are disposable. For example, the mask are disposable. You start reusing it, even though it's not recommended, but it will at least give some protection. The same goes for certain, the gowns. The gowns, you're going to start having reusable gowns and washing them. So there's other ways of trying to do it. It's not optimal to prevent the transmission, but you're going to get pushed toward doing that, unfortunately.
Dr. Hassoun, we know cities and countries across North Alabama are starting to implement mask ordinances. Is this the right move, and is this something that you believe needs to happen statewide?
I think, again, and I've said that multiple times, I think mask is part of the equation, and definitely at the moment it needs to be implemented statewide, specifically in areas where there's significant exposure, meaning closed spaces, building, gathering. Everywhere there's a higher chance where more than 2 people is around. You're going to need to put it, and the state going to need to implement it. I really believe, again, like what Mr. Spiller said, you probably, if people don't follow the rules, we're going to need to have a lockdown. We're going to need to have something where close businesses to reduce transmission. Otherwise, this is not going to end in the right way.
Yesterday, Crestwood Hospital CEO Dr. Pam Hudson said if everyone follows social distancing and wears masks, she believes the number of cases would drop in 2 weeks. What is your opinion on that?
So I think it definitely helps if there is really strict follow-up to the rules of physical distancing and then masking. What I've seen over the last few months, unfortunately, there's really no follow-up for these rules. So I really doubt. We keep saying we're going to need to do it, we're going to need to do it, but we see the community is really not following it. And the best example when this not happens in cities where they were able to control the virus, unfortunately to say, the only way was locking down and closing businesses and then restart it again, rather than waiting for community to follow this, because it doesn't seem it's happening at all.
A lot of people are against wearing a mask for whatever reason, claiming it's a bother. They're being forced to do that. It violates their rights. So what is your message then to those people who are against wearing a mask?
You know, I think those who's refusing, unfortunately, increasing the risk of transmission, increasing the rate of infection, increasing the rate of hospitalization, and putting people at risk of death and severe cases. They need to understand by not doing this, they might be okay, but the community not going to be okay. And it's going to be affecting them in a way or another, because it's not only COVID we worried about. You know, we're trying to reduce COVID transmission and infection, but if the hospital pressured in a way with no beds, we're really not going to be able to take care of non-COVID patients, like heart attacks, strokes, all different kind of diseases that there's not going to be beds available. It's going to be pressured in a way. Unfortunately, some people will die from non-COVID related issues, which is, again, will be preventable.
We have a lot more to discuss with Dr. Hassoun tonight, including if you should feel comfortable sending your kids back to school.
Stay with us. You're watching Way 31 News at 6.